Hi friends, today we are going to discuss CPR. CPR is also called as cardiopulmonary resuscitation. When we find someone who is collapsed and has no breathing, it is the situation where we conduct CPR. CPR keeps people alive until help team or ambulance arrive. It is a life-saving skill. It is easy to remember as ABC. It is also remembered as Doctor's ABG, which is safe to remember as Doctor's ABG. In Doctor's ABG, D stands for danger. First, when we find a person unconscious, we have to see the scene safety. We have to look where the patient is lying or where the unconscious patient is lying. If he is unconscious by any electricity or any other issues that make him unconscious, or it is on the road, we have to take the patient to the safe side to perform the CPR. It is useful for you and the team who came for help. R stands for response. Shake the patient gently by shoulder. Ask him, "Are you all right?" If there is no response, you should shout for help. A. Airway. Lightly lift the chin to open up the airway. We have to C for breathing. B for breathing. Listen, feel, and look for the signs of normal breathing. Look for normal chest movement. Listen for normal breathing. Feel for normal breath near your face. We have to check carotid pulse along with it. Do all these in less than 10 seconds, not more than 10 seconds. If there is no sign of breathing, we have to start CPR. Make sure health team or code blue team or ambulance is on the way. And C stands for circulations. We need to use compressions 30:2. 30 compressions and 2 breaths on the chest. Placement of your hands below the nipple line. Place the heel of one hand on the center of the person's chest. The other hand interlocks with arms straight. Press hard and fast. Let the chest recoil fully each time. It has to be 30:2. Depth should be 5 centimeters. If we meet the speed and depth effectively, the CPR is effective. After every 30 compressions, we have to give 2 rescue breaths to provide oxygen. If second person is also available, swap or shift the positions to avoid tired. Do not stop compressions until your help team is available. If possible and available, we can use defibrillator. Actually, we can be more comfortable with AED. Summary of CPR. When we find an unconscious patient, we will check for the response. If the patient is not response, we will check for the doctor's ABC. D stands for danger. R stands for response. S stands for shouting for help. A stands for airway. B stands for breathing. C stands for circulation. D stands for defibrillation. CPR should be continued until we receive the normal breathing and pulse of the patient. Our emergency team arrives and shifted the patient for the further management. Thank you. If you liked the video and if you feel it is informative, please like, share, comment and subscribe.